My name is Dr. Maria Giroux, and I'm an obstetrics and gynecology resident at the University of Saskatchewan. I'm here with Suzanne Funk, who's a pelvic floor physiotherapist. She has been a physiotherapist for the last 25 years and a pelvic floor physiotherapist for the last 10 years. Welcome, Suzanne, and thank you for agreeing to speak to me today.
Thanks for asking me, Dr. Giroux. I'm really excited about today. I get asked all the time by other physios, by clients, by physicians, what do we actually do in pelvic floor physio? A lot of people are quite surprised when they get a referral for it or if they even hear that we do pelvic floor physio. So it's really good that we're going to have this discussion today and kind of just talk a little bit about what goes on or what to expect when someone goes for a pelvic floor assessment.
Do you need any kind of specialized training to become a pelvic floor physio?
Yeah, we do. So we all have our basic physical therapy training that we take, but then on top of that, we do have specialized courses that we have to take. And then once we've taken those, then we can treat in pelvic floor.
And why would someone need pelvic floor physio?
Well, there's a few different reasons why people would come for pelvic floor, and we actually treat kind of varied age groups. Like we'll treat children and adults. We also treat males and females. And basically, when we're treating clients, we're looking at three main things. We're getting a lot of people that would have issues with incontinence. So whether it's fecal or urinary, we'll have prolapse, whether it's bladder or cervix or bowel. And then we have a lot of, and I like, not that I like, but I'm seeing a lot more of people coming in with a condition called pelvic pain, and we didn't diagnose that a lot before, so we're getting a lot more of that coming in as well.
How do patients develop these conditions?
Again, there's a few different ways that people can develop them. So sometimes people will have symptoms and concerns with the pelvic floor following surgery. So whether they've had hysterectomies or if males have prostatectomies. Sometimes it's post-infection. If you have recurrent infections, you can end up with issues with the pelvic floor. We also end up with medical conditions like endometriosis, polycystic ovarian. Sometimes the pelvic floor kind of changes a little bit with that. And then lastly, or the most common, would be postpartum. Then usually we're seeing women after that.
And what do you do during your assessment, and how does it differ from an assessment done by, let's say, obstetrician or gynecologist?
Yeah, it is a little bit different. People kind of come in and they're not sure, are they going to have their feet in stirrups? Is there going to be a speculum? We just use a regular treatment plinth in any physio clinic. There's no stirrups, and we don't use any instruments of any type. Typically, certainly not when we're doing the assessment. We're just doing it with a manual examination. When we do the assessments, it starts also just like any other physio assessment where we're doing the full, complete kind of subjective history, getting their signs and symptoms, kind of getting their medical history, surgical history, things like that, any concerns that they have. Then we move on to the objective examination. We're starting always with a basic kind of physio assessment of the back, hips, and pelvis. That's what people are really used to, so that part is very familiar to them when they're coming for their physio assessment. And then we move on to the pelvic floor. And then when we're doing that, we're kind of breaking that down into assessment parts just like we would any other part of the body. So we're doing observation where we're looking at it, where we can kind of gain a lot of information just from that. And then we do the physical assessment of it where we'll physically check, usually by manual exam, possibly single digit exam, depending on the client. And we're checking for scar tissue, kind of its sensitivity, any how it moves, like the flexibility of that. We're checking for muscle strength because sometimes, if we deliver human beings out of vaginas, the vaginas usually are a little bit different after. So sometimes the muscles don't work the best, and we need to see how that's working. We're also checking for muscle tone. Sometimes we can have an increase in tone in the area. So it's different than something that's weak. It can actually sometimes be kind of crampy and tensed in those muscles. And I can't remember if I mentioned already, but if I didn't, we'll also check again for prolapse just to see if that's a problem.
Okay. And for patients who just had a baby, when do they need to see you postpartum?
Typically, their physicians will tell them, and it's typically at 6 weeks. So they'll wait, the physician will check, make sure everything's healthy and everything's looking like it's coming along good. And it's basically about the same time that they clear that individual to have intercourse, then they're usually ready to start physio.
Okay. And what do you do during that assessment?
Like I mentioned before, we are going to do the observation. We're going to check for tissue mobility, as well as like scar tissue sensitivity. We're going to end up checking for muscle strength, kind of looking towards the front or that kind of anterior aspect of that pelvic floor, as well as posterior aspect. And we're checking for muscle tone, and we're checking for sensitivity. So for pain as well.
Okay. And what about patients who are on their period or have menses? Can they attend to your session?
Absolutely. We get asked that so much, and people are just concerned that it's going to impact how we're going to do the assessment or do the treatment, but it doesn't at all. They absolutely can attend, and we just have strategies and means of accommodating that or dealing with that.
Okay, very good. And how long is the assessment?
The assessment is typically 1 to 1.5 hours, just because we need to have a lot of time to do that full thorough assessment, including like the subjective history, the objective examination. Plus we also have to build in time so that we can actually do the treatment according to what we find in that assessment. Sometimes we're just teaching the client how to do the treatment, but sometimes if they bring their partner, I am more than willing to, and I know a lot of other practitioners as well, will teach the client's partner how to help out or assist with some of the treatment techniques as well. It also builds in enough time for us to do a lot of patient education. Clients are coming in with a lot of concerns, a lot of unanswered questions. This is an area of the body that we typically don't look at, we don't touch, and we don't talk about it. And when they're coming for their pelvic floor physio, we are doing a lot of that, and we're going to make sure that all of their questions are answered when they're there.
Okay.
Yeah.
And taking into account that everybody is a bit different, what type of therapies do you usually prescribe to patients?
Well, again, like you said, things are a little bit different, but typically we're doing certain things that all the time, and just kind of maybe in varying degrees of where our focus might be. So if we have someone with scar tissue, then we're looking at mobilizing that scar tissue. So maybe massaging, maybe doing a bit of stretching. If they've got a strength issue, then we're going to teach them those strengthening, and we're going to be really specific about it. We're not just kind of teaching generic exercises. We take and look at what our assessment findings are and where their exact weaknesses are, and we're trying to teach them how to get those muscles to contract better. If it's more a problem with pelvic floor tone, then we're going to end up teaching them how to actually relax. And that's harder for some people than they might think. So we're incorporating things like breathing. Sometimes I'm even teaching them a little bit of basic meditation, just ways to try to get that body and that mind to relax. And then a lot of kind of almost neuro retraining we're doing a lot of times, where we're really trying to get their brain to kind of recognize and refamiliarize itself with that pelvic floor so that it can teach it and kind of tell it and get it to do what it wants to do again, whether that's strengthening, whether that's relaxing.
That's really interesting. Well, thank you so much for teaching me about all of this. Is there anything else that you would like to talk about?
The only other thing I forgot to mention earlier was that the assessments are about 1 to 1.5 hours, but the subsequent visits are about 30 minutes, just to allow us time again to reassess, kind of address any concerns the client might have, as well as do any treatment, and then teach them any new exercises that they would work on between then and their next appointment. The other thing is we often get asked about whether or not they need a physician referral to attend for physio. And typically they don't, because we do have direct access. So absolutely clients could come in straight off the street and ask for a pelvic floor assessment. However, our preference is typically that they do have that physician referral. It just gives the physician that, or at least that client, that touch point with the physician to make sure that they are otherwise healthy and they have no concerns that need to be addressed medically before coming. And if they do come and they don't have a physician referral, and when we do the assessment, we see something or we suspect something that should be addressed by the physician, we absolutely will make sure that they know that, and then we refer them back to their physician prior to proceeding for further physio if that's what we need to do.
Well, thank you so much, Suzanne. I had a really good time talking to you about this, and I appreciate everything that you taught us today.
Thank you. And again, I'm just really grateful to have the opportunity to discuss this, because a lot of people just don't know what we do, and this was really helpful, I'm sure, for very many people.
Thank you.
You're welcome.